Here we are 1 week after a treatment of this very severe, basically, not that you had a lot of choice when your knee hurts a lot, but this would be considered one of the total knee failures in the sense that she was left with chronic pain. Is that a fair statement?
Absolutely.
And inability to flex as much. So now she's going to try to flex her knees up. Both knees up. Oh yeah, that's better. Look at that. Yeah. So now, on her own, she can flex it that far. Now, Maria, go to her good leg, and you'll see you can get more out of it. Yeah, there, she even could get a little more, but not a whole lot more. Now, go to her bad leg, and slowly see if you get much out of her. Not much. Is she hurting you?
Well, I feel a pull,
Yeah.
but it's not as
So, do that. Now, pull them both up again, as far as they can go. I think, yeah, your left. Can you go a little further with your left or not really? Okay, Maria, pull them one more time and then we'll take a movie. No, one at a time. So this one you can get another 5 degrees or so. And the other one you feel resistance. Well, you get a little resistance. So we'll check that after we inject her. Hold on, she's mentioning some things she can do now that she couldn't do. So mention about the foot.
Okay, I could get my foot flat, so I'm getting more range of motion. Which is a more comfortable position than being out like this all the time.
Because you couldn't bring the knee in enough to flatten out the foot. Now I see what you mean. Any other thing you want to mention, other than you can sleep through the night?
I love you.
Okay. Yeah. How about sleeping through the night?
Okay, before a week ago, or 8 days ago,
Yeah.
I would wake up most times all through the night when I had a turnover. And now that is not the case, and I could comfortably bend my leg and sleep. I like to sleep with one leg bent up.
That makes me feel good.
I could not do that.
Wonderful. And here she is post-treatment. This is, again, her bad leg here. Now you go ahead and move your legs as far flexed as you can. And if you can get it at her heel level, you can see she's short a few inches. Now, I can now pull that knee to the full range of motion, which I couldn't do before. And that isn't even hurting, is it?
No,
So
it doesn't even feel tight.
She can't even tell that bothers her. Now the other position was, what, flexing your knee when you're on your back.
Okay.
Let me get these bloody things out of the way. Luckily it's your blood,
Right.
so you won't get any problems from it.
No, that's healthy blood.
Yes, I'm not even worried about it. Alright, now to do the flexion this way. This is the normal knee, and you can get it pretty far up. And now, we'll try this guy.
You're hurting me where
yeah, I'm pushing with my hand. Knee is not hurting? A little bit.
No, a little bit there.
So I can't get it as far, but close. It's getting closer each time. And the actual fluidity of motion is much better before. Before this would have been stiff when I got to here. And it's very little resistance. Compared to her normal knee, it's very close at that level. Very good.